I know that Medicare and health costs in general can be a real concern for a lot of retirees. And like anything else you might want to purchase, you need to do your homework, gain the knowledge to be able to make the best possible decisions. And these decisions can either save you money or not. I'm so happy to have Dan Chalky with us today. Dan, like my last guest, is just a really smart guy with a natural gift to explain the most complicated topics in an understandable way. He's helped many of our clients with their Medicare options. So with that said, Dan, I'd ask you to join me to discuss Medicare and in particular, the upcoming open enrollment and changes you're seeing with Medicare. I know you've prepared a few slides, a few things to go over, so I'll turn this over to you.
Well, thank you, Pat, for the very good introduction. Just a quick, brief bio on my part. I am a Northeast Ohio person, born and raised in this area, currently living in the Massillon area. So been working with Pat and his brother Jim for many years. Very happy to be involved with the Seaman Retirement family. And Patrick, once again, thank you for having me on today. I'm going to start my presentation with some of the basics. It's kind of like the blocking and tackling of Medicare. We call it the ABCDs of Medicare. And Part A is known as the free benefit. And, during my 30 plus years in HR, people used to always say, I can't wait till I retire. I get 65 and can get free Medicare. But keep in mind, it's only free if you paid 40 quarters into the Social Security Administration. So those people that haven't paid 10 years into this plan, obviously there is some premium payment that's involved. But Part A covers long-term care, hospital, hospice, rehab, those types of situations. Part B is known as the medical side of Medicare. It covers doctor appointments, outpatient care, preventative services. Your vaccines are covered under Part B, like your COVID vaccines, flu shots, and there is a premium involved. The current premium is $174.70 a month. We anticipate that probably will go up in 2025, and there is a deductible. So there are some out-of-pocket costs involved with Part A and Part B. Part A and Part B together, if you add those together, kind of like the old algebra class, A plus B equals original Medicare. So when people talk about original Medicare, that's what they're talking about, Parts A and B. Part C, this is where people tend to get a little confused. So if you think a year ago, when you saw a lot of Joe Namath commercials on TV and he'd say, boy, I can put more money into your Social Security check, those are Medicare Advantage plans. And as a matter of fact, you probably haven't seen him doing those commercials anymore. I think now he's selling hearing aids because those commercials were outlawed because they were very confusing. But Part C are your Medicare Advantage plans. They're sometimes known as the all-around plan. They can offer some additional benefits like dental, hearing, gym memberships, some of those other adjunct plans that might be involved there, known as Medicare Advantage or Part C plans. They are private plans offered by private healthcare companies, but they must offer at least what Part A and Part B offer. They have to offer those original Medicare benefits. Part D. D is the easiest one to remember because D basically stands for drugs or prescription medications. So any type of plan that you would stick with, like with the original Medicare, if you go with Part A and Part B, if you want additional prescription coverage, you have to add a Part D because original Medicare does not cover prescription medications. And once again, there are costs involved with the Part D plan. Many people are kind of surprised when I go through an enrollment when they first enter into Medicare, thinking they were going to get all these free benefits because they've been paying into the Social Security Administration, but only really a partial part of your benefits are free. I do want to highlight too that third bullet known as the IRMA adjustment. For those individuals that are currently making over $103,000 per year, or for those that are filing jointly that make over $206,000 per year, there are adjustments or additional premiums that may be added to your Part D, which is drugs, or your Part C or Part B benefits. So keep that in mind too. And we can get into more detail on that if you want to schedule a more detailed meeting. Medigap, or what is also known as Medicare Supplemental. If you choose not to go down the Medicare Advantage route and you want to stick with the original Medicare Part A and B, but you want a plan to fill in the gaps. So think of Medigap or CALC that fills in those gaps. Many of the clients that I meet with, many of the clients that I have a Medigap plan, because if you compare the costs, your annual costs with a Medigap plan versus a Medicare Advantage plan, more times than not, you have a better coverage and your costs are less with a Medigap plan. Once again, they're private plans like the UHC, Humana, what have you, and they have to offer, what original Medicare offers at a minimum. And then, like I said, it fills in the gap. So like the coinsurance is a big piece of Part B. So Medigap plan is usually a good fit for that service.
Let's say, Dan, is there some restrictions that you have to pick one or the other? And once you pick one, is it hard to go back to the other type plan?
Once you sign up for a Medigap plan initially, when you are initially eligible for Medicare, there isn't any medical underwriting. If you stay in a Medigap plan for a couple of years and decide to go to a Medicare Advantage plan, no medical underwriting. However, if you want to jump back into a Medigap plan or change a Medigap plan, that's where your medical underwriting comes into play. So that is a cautionary note that I would let people know, that if you choose a Medicare Advantage plan when you first turn 65, and then a few years later decide to get into a Medigap plan, just keep in mind there could be some medical underwriting there.
So do you have a crystal ball that help people decide which plan based on their health in the future?
I do.
Because that's what it seems like. You need to really understand, hey, what's going to happen to me in the future? And you might have some family history or some medical condition now that would help you decide. But is that part of kind of the evaluation?
Well, that's a good question. It's, when people get to that Medicare age and they're trying to figure out when they're at that crossroads, should I pick a Medicare Advantage plan or a Medigap plan? There are a couple main ideas or main points you want to consider. Number one is freedom of choice. If you don't want to be held to a network or have to choose a primary care physician or don't have to worry about pre-authorizations for a surgery, a Medigap plan is a better fit for you, especially if you travel a lot, because you can go anywhere in the country to any doctor, and as long as they're a Medicare-approved doctor, you can go to that facility. With the Medicare Advantage plan, a lot of times you are restricted more to a network, so you have to stay in that network, you have to get prior authorizations. However, if you're a very healthy person, and I have many 65-year-old clients, they don't take any prescribed medications, they're very healthy, they don't have high blood pressure, what have you, a Medicare Advantage plan is probably a better fit for them because the premiums are lower, and the only time you're paying is when you're using the system. So it's a better fit. For those of you that are already enrolled in Medicare, you have an opportunity every year to make changes. So starting October 15th and then through the first part of December, you can look at your plan. Anybody that's currently on Medicare is eligible, and you can make those changes. They're effective January 1st. And by now, normally by the end of September, anyone that's currently in a Part Medicare Advantage plan or a Part D plan, you've already received what's known as an annual notice of change. It's a very important document from your health carrier. So let's say you're on a UHC plan or Humana, what have you. They have to send these out. It's a requirement of Medicare every year. And it's going to tell you what medications have changed. You may be on a medicine for high blood pressure, for an example. The plan may still cover it, but that medication may have moved to a different tier. So you might have a little more out-of-pocket costs. or they may have dropped that drug. So it's very important to look at the prescription changes. It'll also list any premium changes, and it will list any network changes. So if some of your doctors or some of your healthcare facilities have either been added or dropped from that plan, those are the issues that need to be addressed with this annual notice of change. If you have any questions or you would want someone like me to review that information with you, this is the perfect time to take a look at that and see if there are other plan options that may be a better fit. And basically, any change that you want to make, like if you want to go from one Medicare Advantage plan to another Medicare Advantage plan, if you want to go from Medicare Advantage back to original Medicare, any of those changes are eligible. You can make those changes during this time, October 15th to December 7th, and then those affected changes or those changes go into effect on January 1st.
It's got to make you pretty busy during that time, I would think.
Yes, that is a very busy time. So you asked about the crystal ball earlier. So we know for a fact some changes are going to be made in 2025 for Medicare. We know that Part D deductible or Part D, the prescription drug, is going to go up slightly, except from $545 to $590. But a key change is the elimination of the coverage gap, or what was called the donut hole. Once again, a very confusing part of Part D prescription drug, the Part D prescription drug plan. And huge change is your out-of-pocket costs for prescription drugs are going to be maxed at $2,000. So I have several clients that are on very expensive, especially some of these expensive diabetic or blood pressure medications that have been paying upwards of $4,000 to $5,000 a year for those medications. Now it's going to be maxed at $2,000. Another nice feature that Medicare's introduced or will be introducing in 2025 is a payment plan. So let's say you are on one of those expensive medications and you're going to be spending up to $2,000 for the year. Medicare is now allowing you to set up a monthly payment plan with your Part D carrier to spread those fees over the course of the year. Another point I want to make there too is a lot of Part D plans come in two forms, what's basically known as a basic plan and an enhanced plan. Enhanced plans sometimes have a higher premium. So for an example, if you're currently paying $5.40 a month, but you have a plan option that might be $14.40 a month, that $14.40 might be better money spent because the drugs or the coverage that is offered may cover that drug more significantly through the course of the year. So once again, a perfect time to put pencil to paper to see what your annual costs might be. And you can Google, 2025 changes. There's a lot of speculation out there right now, how much the premiums are going to go up, how much the deductibles might be going up. My basic, what I normally tell people is, since Medicare has reduced your out-of-pocket cost or the beneficiary's out-of-pocket costs, it kind of forces these carriers to come up with some different ways of recuperating those costs. And the way they do that is by increasing premiums and increasing deductibles. So we won't know till closer to the end of the year how that's going to affect those costs. In 2026, you have probably heard a lot about negotiated rates that Medicare now can negotiate with Big Pharma on some of these drugs. There are 10 drugs there, the Eliquis, Jardiance, and some of the others that are on that list. I get a lot of questions about Ozempic. Ozempic now seems to be the wonder drug for not only diabetes, but also for weight loss. Keep in mind, Ozempic that is prescribed only for weight loss is not covered by Medicare because it is not the original intention of that medicine. The original medicine, Ozempic, is used for diabetic control. And although it has been shown now to help with dietary and weight loss, Medicare is not going to cover that at this point in time. So Pat asked me to mention a couple examples. So if you're sitting in a situation where maybe you've been on Medicare for a while, you have had very good health, but now you know that maybe a knee replacement is in the future or some other type of major medical. So now is a great time, as I mentioned, during this annual enrollment process, to possibly look at going into maybe a Medigap plan that would offer more coverage or a lower out-of-pocket cost for a type of procedure like a major surgery, something along those lines.
All right, well, I'm going to go ahead and just kind of wrap this up. And again, that was kind of the thing I was pretty interested in, was just seeing kind of if someone's circumstances have changed, like a new medical condition or something like that, a new drug, kind of how that would warrant a review, which I think that would warrant a review of your Medicare plan if you saw something different in your medical condition or expect something different over the next year. And I certainly think the other thing that we look at are the fact that Medicare is changing. And because of those changes, you may want to consider reviewing your plan and even making changes to your plan. So with that said, I really hope this webinar was helpful. Well, we do thank you so much for attending and taking the time to be with us today. So with that concludes our seminar. Thank you very much.